Human Resource Management Case Study on PAC Resources, Inc., Focusing on Safety and Security by Jason Denise, Courtney Boone, Caitlin May, Ellen Edgar, and Amanda Askenberg.
After conducting the SWOT analysis for PAC Resources, Inc., it was revealed that the company had a number of weaknesses, including poor management, inconsistency in policy enforcement, unfair practices, lack of cooperation and communication, cost containment, and staff reductions. However, several strengths were also found, such as open door management, enhanced communication efforts, employee assistance program. In addition, some threats and opportunities were discovered as well. Threats being decline in sales, increasing rate of workers' comp claims, and backlash of staff reductions. On the other hand, the opportunities revealed include the development of an idea blog, a bonus plan, and a cost-saving allocation plan. In addition to the SWOT analysis on the whole company, I also conducted a SWOT analysis focused in on the safety and security aspect of PAC Resources, Inc. Again, strengths, weaknesses, threats, and opportunities were analyzed. Included in the strengths of safety and security were safety training, an elaborate database, and an active wellness program. Weaknesses were in regards to ill-prepared management and that there were a high number of employees with carpal tunnel syndrome. In addition to strengths and weaknesses, the safety and security aspect had some presenting threats in regards to workers' comp claims, a hiring freeze. PAC also had an important opportunity of a partnership with a local hospital.
A job hazard analysis is a systematic approach to identifying and eliminating workplace hazards. According to OSHA, this approach focuses on the relationship between the worker, the task, the tools, and the work environment. Many different factors are taken into consideration when analyzing. It is basically a process of eliminating the hazards and risks within a situation before they cause an accident. When conducting a job hazard analysis, also known as JHA, it is important to involve your employees and let them know when observing situations you are studying their task and not their performance. It is also important to ask specific questions when looking at a specific situation. You should ask, what can go wrong here? What would the consequences be in the result of this situation going wrong? How could it happen? And what are all the contributing factors? Once these questions are answered, you can start taking steps towards eliminating the hazards. When creating a safer environment or a safer way of performing a task, it is extremely important to train all employees on the new changes. Conducting a JHA is important in general due to the fact that in the U.S., many workers are killed or injured every day due to job hazards. It would be very beneficial to PAC because the analysis would help eliminate any hazardous work situations, which would in return help reduce the amount of workers' compensation claims that are currently being reported quite often at PAC. In the end, this would help PAC save money.
PAC has some financial problems, and the budget committee is thinking about removing the employee benefits of having a wellness program, which includes health assessment, healthy weight program, and smoking cessation. To have healthy employees should be a main priority for PAC. To support wellness programs, financial take care of the existing ones. Some health problems that can be prevented with the wellness program could be alcoholism. Alcoholism is a serious problem and leads to reduced productivity, absence, accidents, and health issues of employees, which affect their work negatively and increase the costs for the employer. Employee alcoholism may cost employers about $226 billion per year for absence and accidents. A wellness program can reduce the number of people having these problems. Another important issue is stress. Consequences of stress are mental issues like anxiety and depression, but also physical like headaches, diseases like Alzheimer's, and increased risk of heart attacks. Research has shown that healthcare costs for stressed workers were 46% higher than the less stressed. The consequence for the employer will be decreased performance and increased absence. An advice from Dr. Herbert Fraudenberger in the Human Resource Management book by Dessler is that it is important to stay active to avoid burnouts, and a stress reduction program can really help the employee's mental and physical health. This is evidence why the company wellness programs should be saved. Another problem is smoking. Smoking is a serious health and cost problem. For employers, this implicates problems of higher health and fire insurance, increased absence, and reduced productivity due to frequent smoke breaks. It also leads to serious health problems of the employees, which could lead to death. This is why it's so important to keep the smoking cessation program. Overweight is also a problem, and to provide a healthy weight program is important because overweight leads to serious health problems. For example, problems with heart and orthopedics. The program can lead to increased energy and productivity of the workers and prevent expensive, reasonable accommodation adjustments to help overweight employees with health issues and ergonomic problems due to overweight.
I am going to discuss what possibilities PAC has to differentiate their health insurance costs, if it is possible for them to provide different levels of coverage for smokers and for non-smokers. And I will also address the issue of dependents who smoke. And the entire discussion will touch upon discrimination. PAC did give their employees full health insurance coverage until 2006. Then they realized that they did not have the financial opportunity to cover the full insurance. The employees now have to pay part of the cost themselves. Today, many people actually choose their jobs based on what level of health insurance the job offers. Health insurance is in general available to everyone, regardless of health and physical condition. According to the Title V of the Civil Rights Act of 1964, you cannot discriminate anyone based on gender, race, or national origin. Those rules of discrimination can also apply to healthcare questions. PAC could differentiate their health insurance costs if the differentiation does not discriminate anyone according to the Civil Rights Act. An example of what would count as discrimination would be if PAC charged all women more insurance costs than they charge for all men. Regarding the question if it is possible to provide different levels of coverage to smokers compared to non-smokers, PAC have to consider the problem of defining smoking. Is a smoker an employee who smokes several times a day, or could it also be an employee who smokes once a month? They also have to consider what consequences to impose towards the employees who claims they do not smoke but who really does. Will they just remove the higher level of coverage, or will the employees actually be fired? Firing the employees could have the consequences of the need of PAC having to go through the process of finding new employees again, and PAC really have to decide if the risk is worth it.
The Health Insurance Portability and Accountability Act forbids discrimination based on health factors, but there is a loophole. Employers are allowed to give rewards to employees participating in wellness programs, and therefore PAC could give all employees who does not smoke a monetary reward, and the monetary reward could indirectly work as a lower cost of the health insurance. The Health Insurance Portability and Accountability Act also protects discrimination of any dependents based on health factors, so therefore it is not possible for PAC to differentiate their health insurance coverage from employees who is from a non-smoking family compared to one who is.
At PAC Resources Inc., there is a serious situation with various cases involving carpal tunnel syndrome. It seems that the current working conditions are not properly designed in order to provide a safer working environment. Therefore, here at PAC Resources Incorporated, we have decided to implement a program in order to aid in this epidemic in our work environment by helping with ergonomics. The first thing in order to create a program and provide a solution to the problem is finding out what the problem is. In order to do that, we're going to conduct a survey as seen on the screen in order to identify the problem areas in the workplace and to try to identify what may be the potential causes of carpal tunnel syndrome in the workplace and analyze and gather the results. The second part in implementing the program is to gather the results of the survey and use them to provide a training program to educate the employees on having an ergonomically safe work environment, including implementing preventions such as taking frequent breaks, watching your form, and improving your posture, as stated on mayoclinic.com. Once trained on the do's and do nots of an ergonomic environment, we will create an ergonomics committee made up of employees. This committee will provide feedback and look for solutions to jobs that may cause soreness that may lead to carpal tunnel syndrome. The third part is to create an actual program that implements parts 1 and 2 plus a third part that involves actually creating the safer environment. The CTS program, or Carpal Tunnel Syndrome program, will include up-to-date training on ergonomic environments as needed, the involvement of the ergonomics committee to scan the workplace and provide solutions. Then the company will respond to the committee and replace work items with ergonomic work items that the committee chooses as seen fit. And finally, to provide surveys every quarter to determine if there is progression in the workplace and to use the results to aid in any changes needed for the program. With the implementation of the CTS program, there will be a better and safer working environment. We hope that with this program, we will see healthier employees and a reduction of carpal tunnel syndrome within PAC Resources Incorporated.